Miss Parr was a mid-50s woman who was working at Walmart at the time, suddenly had left face, arm, and leg weakness. She suddenly could not walk, went to the emergency room, and was found quite plegic on that side.
I thought this crazy when they first told me I'd had a stroke. And then they told me that it'd gone down at Walmart, that I'd had a massive or major stroke. And I said, they're full of bull.
And the whole worry was that in the emergency room, considering that she had her face, arm, and leg involved, just neurologically, one would indicate that would be a problem in the right side of the brain, perhaps a stroke.
And got to the hospital, and I don't remember that doctor's name that was on duty, but he gave me a TPA shot right then. And then they care flighted me up here to United Regional. And
in this situation, it appeared that on the right side of the brain for this patient, that a small blood clot did go to the right side of the brain, causing left-sided weakness, which sometimes can be permanent.
They said that I had a blood clot on the right side of my brain, which affected the left side of my body.
She was seen in the ER, thereafter went to the ICU for about a day. And slowly with rehab over the next few days, she had a very remarkable recovery. Able to walk with physical therapy, and by about the 8-month point, she was actually back at work at Walmart.
Dr. Pak told me that he honestly didn't think I would ever walk again, that I was just simply amazing at how well I had done with the type of stroke that I had had. And I said, well, I was raised hard-headed, and I'm going to stay hard-headed.
Headaches and head pain is not an indication of stroke, but the weakness, difficulty with slurred speech, tingling, difficulty walking, if it's sudden onset, then there's a worry.
When I started having it, and the right side of the left side of my body started drawing, and my speech did get a little slow and a little weird.
In women, a lot of the times people worry. There are many worries of breast cancer. Of course, you get that checked out routinely. However, in patients and people in general, by even your 50s, you need to worry about the possibility of stroke.
My friends helped me get through this because the people at the hospital said if they knew I'd had this many friends and stuff, they would have put me in a bigger room.
Have a primary physician who you see regularly. Routinely check for your blood pressure, cholesterol, work on your weight. Keep on exercising if you have the time to do so. And I'd recommend, if you're smoking, please do not smoke.
If I had gone ahead and gone and seen the doctor and told him about my headaches, then I might have been able to have prevented this.